Douglas Ross.
I don't know how the First Minister can possibly stand there and say he is supporting people who are struggling when a facility has closed after 20 years of supporting vulnerable women. And the government were involved. Emails that were published in the newspaper article today said that the tendering of 218 was with relevant ministers for review, and that another email
Members, let's hear Mr Ross.
Another email referred to the likelihood of needing ministerial clearance for any new approach. That's in the emails that have been published today. And during the SNP leadership contest, Humza Yousaf said, if there's more money we can give to alcohol and drugs in particular, then that's going to be a priority focus for me. Well, it's clear it's not a priority. Nicola Sturgeon cut funding for drug treatment in 2015 and drug deaths rose. This year, Humza Yousaf has cut the treatment budget in real terms. They promised to create hundreds of new rehab beds, but they've managed just over 30. The addiction crisis in Scotland is out of control. Since the SNP came to power, drug deaths have doubled. They are the worst in Europe, and new figures show deaths are increasing again. Scotland's shame has not gone away. Nicola Sturgeon admitted she took her eye off the ball. Hasn't Humza Yousaf done exactly the same?
First Minister.
No, Presiding Officer, I reject that in its entirety. Let's try to take some of the issues that Douglas Ross mentioned in his question. The drugs budget, of course, we have increased over the years. The increase of funding into drugs policy that we have presided over the last, for example, if I take 2014-15 to 23-24, that's a 67% increase in funding. That's by Audit Scotland figures that were recently published. The draft budget for 24-25 has maintained our budget for alcohol and drugs at the same level this year, and of course this year we've seen record funding, £130 million, into alcohol and drugs partnerships. Douglas Ross references if there was more money. The point is, of course, we've had a £500 million real terms cut to our budget by the UK government. If, of course, Douglas Ross is able to convince his colleagues south of the border to give further funding to Scotland, then I absolutely promise him that drugs and alcohol policy will be one of the areas that we look to give further funding to. In terms of the action that we are taking, again, I'm happy to write to Douglas Ross with more detail. We have, of course, ensured that there's greater carriage of naloxone, over 150,000 kits. We are working with Greater Glasgow and Glasgow City Council on more radical approaches, such as a safe consumption room. We are increasing numbers of beds in terms of residential rehab, and, as I say, continue to work with local authorities to help tackle this issue. I make that offer that I've made already to Douglas Ross, to others right across the chamber, that we are willing to work cross-party in order to resolve what is one of the most difficult challenges this country has faced, and an issue that has plagued our society not just for years, Presiding Officer, but for decades.